Hello, I'm Dr. Evan Levine. I'm a cardiologist at Mount Sinai Medical Center, and I work in Westchester County, New York at the Scarsdale and Pelham Mount Sinai offices. I thought it would be a great time today to talk about remote patient monitoring. Well, what is remote patient monitoring, or RPM? I'm going to give you an example. Well, first I'm going to tell you that I'm going to check my blood pressure right now.
Do not move and keep quiet.
Remote patient monitoring is something like this. You get a device sent to your home, and you take your blood pressure. Now, within that device is embedded a SIM card, something similar to what's in your cell phone. And so that data is sent automatically to your physician to their portal, where the physician and any of the providers in their practice can look at your numbers.
Your systolic
I'm a little
pressure,
nervous now.
133 millimeter
And we're going to
mercury.
talk about
The diastolic pressure is
why you want to take your blood
86
pressure
millimeter
often.
mercury. The
My
heart
blood
rate
pressure is usually
86
116 over
beats per minute.
70. Other devices that you can use besides blood pressure include pulse oximeter, glucose checks if you're diabetic, and you can even check your weight, which can be very important for heart failure patients. But today I'd like to focus on blood pressure. Now, if you look at our chart, I just want to go back to the definition of hypertension. We basically have two stages. Stage one is a systolic blood pressure of 130 to 139, and that diastolic blood pressure of up to 89 but not 90. And stage two is 140 or higher, and a diastolic blood pressure of 90 or higher. Again, I'd like to focus on blood pressure because, believe it or not, about 80% of everyone will have hypertension at some time in their life. And so that's how important it is to know what your blood pressure is and how to control it. Now, the importance of remote patient monitoring is that when you go to your physician's office, you get it checked once. If you go twice a year, you'll get it checked twice. But what about all those other days? How do you know what your blood pressure is in between those appointments? More importantly, if you get anxious, like I'm anxious on this recording, your blood pressure can go up. That's right, 30% of everyone going to that doctor's office can have something called white coat hypertension. And we call it white coat hypertension because most providers wear a white coat. You get anxious in the doctor's office and the blood pressure goes up. And so it may not be so accurate. Now, less common is something called masked hypertension, like a mask. 5 to 10% of patients, when they get to that doctor's office, they can relax so well, calm themselves down, that their blood pressure for that brief moment when the doctor takes it can be lower than it usually is. And so they can mask the fact that they have hypertension. Now, remote patient monitoring allows you to get your blood pressure taken as often as you want. Now, we hope you take it at least 20 times a month or almost every day, but we get lots of recordings with that. So, number one, it's at home. If you have white coat hypertension, we're going to see the more accurate blood pressure. In addition to that, if your blood pressure is elevated consistently, your doctor may be able to prescribe medications for you without even going to the doctor's office. So there may be less trips that you need to go to your doctor. Again, it gives your doctor real-time data 20, 30 times a month. Also provides you with reassurance that the blood pressure medicine is working. And it's also very helpful to remember, to help you remember to comply with your medications. Compliance is a big issue with everyone. And if you see that blood pressure elevated, it might remind you that maybe you didn't take your medications that day. Finally, improves blood pressure control, because if you're watching your blood pressure more often, the blood pressure will be controlled better. Better blood pressure control, what does that mean? That means a lower risk of kidney failure, congestive heart failure, heart attacks, and stroke. Now, it also can mean less trips to that emergency room, because if your blood pressure is well controlled, you're less likely to get complications leading to, again, heart failure, stroke, etc. And those visits to the emergency room, which, let's face it, especially during COVID, frightens many of us. Now, not all blood pressure devices are the same, and you want to make sure that that blood pressure device that you get from your physician is accurate. That's incredibly important. And so when you measure your blood pressure the first time, my recommendation is to take it to the doctor's office and make sure that the blood pressure that you're getting from your device is about the same as that device at the doctor's office. It's incredibly important. There are lots of different remote patient monitoring companies available now. Some use better devices than others. So remember, if the blood pressure device is not accurate, it's not going to help you. It may hurt you. So what I really like about remote patient monitoring, RPM, again, is that you get to take your blood pressure whenever you want. You get to take that blood pressure in the presence of your home at rest when you're relaxed. It's less likely for you to have falsely elevated readings, like at the doctor's office when you get anxious. And your doctor can prescribe medications sometimes without even going to the doctor's office. He might or she might increase your medicines just based upon those recordings. And for that reason, I think remote patient monitoring is here to stay. Medicare now provides patients the ability to obtain these devices through their physicians. And I do highly recommend for anyone who has hypertension, especially again, if they're Medicare eligible, to ask your physician if they're part of a remote patient monitoring program. I hope that's been helpful to you. I'm Dr. Evan Levine. I'm a cardiologist at Mount Sinai in Westchester County, New York.